My name is Dr. Vanessa Ortiz, and I am a physician, a board certified physical medicine and rehab doc at Boomerang in Los Gatos. I went to undergrad at UC Berkeley and studied anatomy and physiology, and I realized that it was definitely something that I was serious about. After that, I was at University of California at Davis and did my medical school training there. And during my senior year at UC Davis, I was introduced to the specialty of physical medicine and rehabilitation, and I absolutely fell in love with it. It was everything I was looking for as far as the types of patients that I was seeing, what my role was as a physician in helping patients improve their functional abilities and improve their quality of life. And it was just the perfect fit. And from there, I went to Stanford for my training in physical medicine and rehabilitation. And after that, realized that pain management was where I should live. And so I've been in the field of pain management for over 24 years. Spine pain management seems to be my wheelhouse. And I see a lot of work comp patients, some PI or personal injury folks. I also do treat private insurance patients and Medicare patients. Well, with patients with chronic pain, I think a lot of it is not only the physical, but the psychological. Learning to deal with living with pain in some circumstances in the long term is a difficult thing. A lot of patients have had lives that, they're very active and suddenly that changes. They have to modify their sporting activities, their hobbies, their work, and helping them to come to terms with that is an important aspect of treatment. In my specialty, of course, I focus on the physical as well, and I prescribe physical therapy. I prescribe pain medications, neuropathic pain medications. I perform injections, including shoulder injections, subacromial injections, trigger point injections. And I also prescribe epidural injections and other types of procedures that help them to get to the point where they can get more out of their physical therapy and get stronger and use less of the pain meds. Because I'm not focused on pain medications as much as some of the other aspects of care. And then with the psychological support with pain psychologists, what I'm hoping for is that folks will get to the point where they're just, again, more functional, where their quality of life is improved. So besides, of course, prescribing medications and physical therapy and pain medicine management, I also perform EMG nerve conduction studies, which is an important diagnostic tool to help further focus a patient's care, as well as help with disability evaluations and the rest. It's a very valuable tool, and it's something that I provide as well. So what I find the most valuable at Boomerang is the functional restoration program. It implements all of the elements of what I briefly spoke about, including the psychological support, the physical therapy and gym workouts and conditioning, the art therapy, as well as instruction on meditation, relaxation, really looking at a patient from all sort of angles to help get them to a better functional level. And the team is amazing at Los Gatos Boomerang. We work incredibly well together, and all of the players in our team really care about the patients. And that's something that I've worked in other areas and in other practice settings, and I find it to be so rewarding to work with this group of people because it really helps patients to get there. I always ask my patients when they've completed the program whether they would recommend this program to another patient. And 99.9% of folks have told me that it was definitely probably the best care that they received in all of their care for their condition. And that's important. The other thing that we offer at Boomerang in Los Gatos is a TRP program. It's a trauma program for folks with PTSD who've had various work incidents where they are suffering from post-traumatic stress disorder. And it's a very focused program where various patients who were injured on the job and who have this condition can help each other towards improving their condition as well. Medications are not magic. They're not the answer. I think everyone's always seeking the magic pill to help them get to the place where they were before their injuries. I think focusing on the entire patient and their psychological outlook as a result of their injury, their physical conditioning and physical therapy is vital, especially initially. I really steer away from opioids in general because I don't find that they're particularly helpful. I will focus on neuropathic pain medications. I am providing care primarily at the Los Gatos site, and really I'm solely focused there at this point. Well, I am fluent in Spanish, so I do find that a good number of my patients are Spanish speaking, and what I'm told by the vast majority of these folks is that they really appreciate being able to communicate and having their physician understand them without a middle person, without an interpreter, because a lot is lost in translation in that scenario. And so that is an additional skill that I bring to the table.